COPD, as you've probably heard it, is a lung disease that makes it hard to breathe. It's becoming more common. And now we have Dr. Raul Ramirez here. He's a hospitalist at CHI St. Vincent North in Sherwood to tell us about COPD.
Good morning.
Thank you for being here.
Thank you.
So I feel like I see the commercials all the time for the drugs that treat it, but I really don't know what it is. What is it?
COPD stands for chronic obstructive pulmonary disease. It's a disease, a very rapid growing in America and in the whole world. It's a damage to the lungs and airways and functional unit of the lungs, which leads to shortness of breath and fatigability. It's the third cause of death worldwide. So it's a quite frequent and it's a preventable disease.
So when people have it, how do they know they have it? What symptoms do they start experiencing?
Initially, it's very silent. For many years, the patient doesn't feel any symptoms, but cough. They start coughing. They have some wheezing, shortness of breath to things that were normal for them to do. And those are the major initial symptoms of COPD.
And also, I see blue lips, blue fingernails. Why would that be an indicator?
Well, that's the very end of the disease. Initially, it's basically very subtle symptoms. And indeed, most of the people, they don't know they have it.
Really? So just small things like wheezing?
Wheezing, shortness of breath, cough. And normally has a lot of phlegm, foamy, white phlegm. And the shortness of breath to exertion is probably the reason number one that they come to the office for the first time.
Gotcha. So when they do come in, they are diagnosed. How do you diagnose them and figure out what they have?
Yeah. We can diagnose them clinically, radiographically, and finally by labs. X-rays can show that. Spirometry, which is a machine that you inhale and you exhale and you measure the time, the amount of air that is eliminated in 1 second, and you can determine whether the patient has COPD or not. But again, the clinical and the exposure, the history of in America, for example, 85% of patients with COPD is smoking.
Oh, and let's get to that because, you know, I'm sure there are some risk factors. You were talking about some things that are preventable. Can you talk a little bit about this?
Yes. 85% of patients with COPD, they're a smoker or former smoker. To qualify for that, you will have to be 15 years of 10, 15, 20 years of smoking. I'm heavily smoking. It's 1 pack a day or more. Some patients may develop COPD with less than that if they have a predisposition in the family history. It's a totally preventable disease because if your parent had the COPD, you're most likely going to have COPD if you smoke. However, if you never smoke, you never have the disease.
So what are some things to avoid? Avoid
all the fumes. Cigarettes are the first of all is cigarettes. The second one will be inhaling irritants, fumes, detergents that are very strong to the airways, anything that could be also acid inhaler. And basically that's about.
Yeah, that's good to know. And then once someone does have COPD, they know that they have it, how can they be treated for it?
Long way we have come in medicine with that. We have the medication that open the airways, so in order to allow the air to breathe in and out more easier. Medication that reduces the inflammation of the lungs. Medication that liquefy the phlegm. Medication that can reduce the process of inflammation in a less extent, but they basically what they do is make you feel better, reduce the flare-ups of the disease, because the flare-ups are the sign that you're going to go in the bad direction.
Gotcha. So you just want to keep it under control.
Under control.
All right. Well, all good to know. Thank you so much for being here. And of course, if you want information, you can always visit CHI St. Vincent in Sherwood, and you can visit you.